March is Colorectal Cancer Awareness Month. Dr. Mark Kiely is a colorectal surgeon at Baystate Medical Center. Doctor, thank you for being with us to talk about this really very important health issue. Right off the top, let's say colon and rectal cancers, as I understand it, are among the most easily preventable cancers if you do the right thing to catch them early.
That's correct, Jim, and thank you for having me. It's a very important topic this month. But yes, colorectal cancer is the third most common form of cancer in the United States, and it's a very preventable and treatable disease. So regarding prevention, the best thing that anybody can do is at a certain age, usually aged 50, is to undergo colonoscopy.
Let's talk about colonoscopy a little bit. Hit that age a while back and put it off a while, but did go through and do it, and thank goodness everything was fine. But people dread it. It sounds uncomfortable. It sounds unpleasant to have a tube basically threaded through you. But in fact, it's a pretty quick procedure, pretty brief, and most people weather it pretty comfortably.
Yes, absolutely. The complication rates are exceedingly low. The procedure itself is usually pretty straightforward. It's done by an experienced gastroenterologist usually. And the bowel preparation is usually the part of the whole process that people dread the most. But you usually just have to drink liquids the day before, follow all the instructions on the bowel preparation. And the sedation that we usually give is very well tolerated. People are virtually asleep for the whole procedure.
Really quite pleasant, to be honest with you, as it turned out, at least in my case. There's been significant success in recent years. Colonoscopy and screenings are working. The colon cancer rate's down 30% in the past decade in people over 50. Deaths due to colon cancer down about 3% a year. So that's really multiplying, again, in the last decade. That's got to be a good feeling to someone who treats this at the serious stage, to see this happening.
Yes, it is indeed, and I think it really signifies that early detection and prevention of colon cancer with colonoscopy works. Polyps are benign entities that can be safely removed endoscopically, and if they're removed early, that precludes somebody from having to undergo surgery. And after all, by detecting any lesion early, you then are preventing yourself from a late detection, which in many cases can lead to much further problems down the road.
Let's take a minute. You already mentioned really age 50 is probably a good marker to get yourself in and get a colonoscopy. Let's talk about some of the other people who perhaps should be especially mindful of getting screened. If there's a family or personal history, it's important, correct?
That's correct. If there's a first-degree family relative that has a history of colon cancer, if they were diagnosed before age 55, a family member should have a colonoscopy at the age of at least 40. If the person was diagnosed greater than 55 years of age, it would be 50 years or 10 years less than the age that the person was diagnosed. So there are some at-risk groups. People that have long-term inflammatory bowel disease are at increased risk. And there are also a few subtypes of patients that have inherited genetic syndromes that are at much higher risk for colon cancer. But in general, those numbers of patients are very small. It's mostly sporadic average risk people that get colon cancer.
In reading up for this, I was interested to find there are some behavioral items that really impact it. Obesity, and certainly a problem in this country, smoking, heavy alcohol use, and a lack of exercise. And to some extent, that almost defines the way a lot of Americans live today. All of those lifestyle issues increase your risk for colon and rectal cancer. Is that correct?
Yes, there are many things that can increase the association with colorectal cancer. There aren't any specific things that absolutely cause that, but also a diet heavy in fat and also in red meat, while not actually causative, they have been associated with increased risk of colon cancer.
And while, as I understand it, the medical evidence isn't perhaps as solid as someone like yourself would like it to be, it appears low-fat, high-fiber diet, fruits, vegetables, whole grains, well, we know it's good for us anyway, but in this case especially, it appears to be helpful for the bowel system. Is that fair to say?
Yes, absolutely. I always recommend my patients to increase the fiber intake in their diet. It's very hard to get all the fiber you need every day by food alone, so in many cases people need a fiber supplement. And certainly a diet healthy in fruits and vegetables is also very important.
Let's talk about your end of the treatment, if you will. We've talked about testing and prevention. If there's a problem found, it's the colorectal surgeon who is called in at that point. And I think anybody can be concerned about surgery. This is serious surgery. If cancer is found, though, there are great advances. There is more minimally invasive treatments now. It is not something to be feared.
No, it isn't. In many cases, we can offer a wide range of surgical options for patients. The standard approach would be a laparoscopic resection of that affected segment of the colon, and generally speaking, patients recover very quickly, rapidly after these operations. For instance, other types of options that are available for patients with rectal cancer, if it's a low stage, this particular lesion may be amenable to removal through a minimally invasive direction through the rectum, actually, and not having to, and the patient will not need to undergo a major abdominal operation. But in general, an abdominal laparoscopic procedure can be performed.
Well, Dr. Mark Kiely, colorectal surgeon, Baystate Medical Center, thanks for spending some time with us and giving us a lot of helpful information about colorectal cancer.
My pleasure, thank you.